Yeah. Hey, everybody. Koviki Talk. Man, we were on a break.
Yeah, we got used to the time off, but it's good to be back on a Monday. Koviki Talk, our multi-episode series by Pacific Islanders for Pacific Islanders. We talk about all things COVID-19, and it's the vaccine now. We've gone, almost a year and 9 months at this point, and we're still doing it, but we're still delivering timely information, accurate information, but most importantly, information about Pacific Islanders. So today we're in the state of Washington, and we're talking about data. I was on a call earlier today about data. I'll talk to you guys about that later. But Naki, why don't you introduce amazing person number one?
Amazing person number one. Dr. Malik Fuimaono was born in California but raised in Samoa, where he attended school in Apia. He received it and accepted a scholarship to Auckland University and graduated with a Bachelor in Science majoring in biology. He pursued his medical school degree from St. George's University and established his residency in internal medicine from St. Michael's Hospital, Seton Hall University in New Jersey. He currently is the Associate Chief Hospitalist at Skagit Valley Hospital in Mount Vernon, Washington. I hope I said that right. He also serves as an adjunct clinical professor for Pacific Northwest Medical School, Yakima, Washington, and is the core clinical faculty for internal medicine residency at Skagit Valley Hospital. He currently lives with his wife, Tusi, and 4 kids in Mount Vernon, Washington. He enjoys volunteering time to help kids and giving educational sessions concerning the medical concerns of our Pacific Islander communities in Washington state. He also enjoys playing rugby in his spare time. Welcome, Dr. Fuimaono.
Thank you, Neki. Hello for everybody. It's good to be back.
I never noticed the rugby, so maybe that'll be in our icebreaker. But welcome, Dr. Fuimaono. Amazing person number two is Joseph Seia. He was born in Los Angeles, grew up in Tutuila and Upolu Islands with his Ainga in Samoa, and eventually emigrated to Duwamish Coast Salish territory with his father Aitulangi Yosefa and his siblings in 1994. He has 15 years of experience in direct service and youth development work, anti-racist community organizing, and nonprofit leadership and administration. Joseph champions systems change work the centers the leadership and history of most impacted communities. He is committed to ending the impacts of systemic racism through coalition building, centering anti-racism principles, and creating intergenerational leadership opportunities to co-design our beloved community. Joseph is Fa'afafine. He's a fierce advocate for QT BIPOC communities. He works actively against the political erasure of Native Hawaiian Pacific Islander communities and will continue to provide soul labor in re envisioning what it means for NHPI people to feel cultural belonging. Joseph currently co chairs the National NHPI Policy Council and also co chairs the local Undoing Institutional Racism Collaborative in King County and is the founder and executive director of Pikawa. Welcome, Joseph.
Awesome. Next, we have Dr. Samoa Reynosamo Md is a clinical research endocrinologist. He has a lifelong fascination with obesity related disorders and has parlayed that interest into research projects investigating the metabolic conditions that affect populations vulnerable to diabetes, such as Pacific Islanders and cancer survivors. Dr. Reynosamo received his medical degree from the University of Washington. He did his adult endocrinology fellowship at the Los Angeles County University of Southern California and his pediatric endocrinology fellowship at Children's Hospital Los Angeles. Currently, he is an assistant clinical professor at the City of Hope Medical Center in Duarte, California. Dr. Samoa is also the lead for the Healing Association of Pacific Islanders, Happy Doctors, which is an organization under the National Association of Pacifica Organizations. Now, Oppo, welcome, Dr. Samoa.
Thanks for having me.
Yay.
See, the hosts will struggle just to get the bios done. All of your accomplishments are just hard to read. Um, but I think that a lot of the time that we're spending together is because of the things that you've done. So the longer the bio, it just means We always talk about service to the community. The longer the bio just means the more service that you all have provided to the community. So, welcome. And I don't even know, I was so late getting on with my audio problems. I don't know if Naki gave any heads up for the icebreaker question, or if she's just going to bust it on everybody now.
I did. I thought I did. I think I did. I think I did. So our icebreaker question today is 60s, 70s, 80s, 90s. Which decade do you love the most and why? And we'll start with Dr. Samoa.
Uh, I don't know if I have a favorite decade. I'm a child of the 80s.
Yeah.
So I guess sentimentally that's my favorite. Um, uh, yeah, I think if I had to choose a decade that most impacted me, that would be it. It would be the 80s. Like
The
the
80s.
music,
Yeah.
hip hop was kind of pretty much born in the early 80s, late 70s. What else was there? A lot of early Samoan, a lot of second wave, third wave migration to Washington happened in the
Mhm.
80s. So, a lot of churches started at that time.
Yeah.
Yeah, so there's a lot of sentimental feelings around the 80s. So I'm gonna go with the 80s.
80s. Awesome. What about you, Dr. Malik?
Yeah, I would say the 90s. Kind of like Dr. Samoa. Those are the formative years. I was in high school around that time.
Yeah.
I feel like 90s is it though. I mean, people are bringing back the 90s right now because,
I know.
in terms of movies, music, that was the decade though. So
Right.
definitely, I would say 90s though. I still have 90s playlist in my office to kind of listen to when I'm working. So
That's
yeah.
awesome. I think like even the kids these days are
Hmm.
playing 90s music and
Even
watching
the
the old
fashion, it's
shows.
coming back though. Yeah.
Yeah. They're even watching the old shows from the 90s.
Hmm.
So, yeah, that's a good one. How about you, Joseph?
Yeah, I'd definitely go back to the 60s because definitely a child of revolution. And just to to be here in the midst of all that change, right? The
Right.
cultural, systemic change. Dr. King, we've got our people back home in Samoa's independence, 1961. Just feel like the 60s was when there were a lot of things changing, and I kind of want to see it so like we can preserve like the what do you call it, the study of it, you know.
Yeah.
So I feel like we've missed a lot of lessons that we could use in the movements now.
That's awesome. What about you, Carl?
Oh, I'm going to go 60s as well. Same idea. That's when a lot of change was happening. I think that,
Mhm.
there's just so many different things that started in the 60s. And I'd like to see another 60s in terms of change uh, come again. But yeah, I'm kind of with Joseph in that. But a lot of things happened um, for the country in terms of changing things for people of color and underserved people. So, um, but unlike Joseph, my birthday starts with a six.
Whoa. No.
I know Joseph is a young buck.
Right.
Well, what is he? Does he have an 8 in his
I'm
number?
I'm middle aged. You guys are just old.
Ooh.
Okay, we're gonna disconnect Joseph right now. I picked the 70s only because my dad was alive then. My grandparents were alive there then, and I wish I would have recorded them telling stories, and I don't know how I would have, but I would have loved to taken in their stories a little bit better. When they were talking, I was like, yeah, 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 or just not paying attention like I should have. So I think I picked the 70s because a lot of my family members were alive then. And so I would have asked as many questions as I can about growing up and Samoa, really how it's changed. And so yeah, so that's great. Everybody has a great answer. I love that. So we're talking about the Dr. Samoa did a survey, and then Dr. Malik and Joseph were kind enough to give us some time today so that we can talk about the numbers there, because the numbers in Washington, even with just vaccination, like King County, you guys are kicking butt up there. And I know we've mentioned it before, but I just think it's, what are you guys, we need to know what you guys are doing in the states so that we can share it with the rest, Texas and California and Atlanta and New York. Just, we're going to pick your brains to see what it is that you're doing that's working there, so that we can spread the love, and then also share all the great information that Dr. Reynald Samoa has to share with us. So Dr.
Yes, so it's really important for us to be able to speak about our experience to help communicate need. And so data is a big part of that. So the AAPA needs assessment um, was done for communities of color during COVID, and Nia Aitoto and I were the ones who led the Native Hawaiian and Pacific Islander aspect of the study. So the reason why this is a pretty amazing
Nice.
setup that we have is because the data is data, and that's how you talk to um, health departments. That's how you talk to
Right.
federal organizations. But that's not our story, right? And so you need to be able to put this into context, and that's what Joseph can do as well. But what makes this kind of group very, very special
Mhm.
is that we also are in those fields where we have direct observation
Yeah.
and expertise, and so it's important for us to be able to fall back on that. And the Healing Association of Pacific Islander doctors, Happy Doctors,
I love that.
is part of that, and Dr. Fuimaono and are part of that group. And Dr. Fuimaono practices in Washington and just like the Oregon group with Dr. Kalani Raphael,
Yeah.
can provide some interesting insight that's not really communicated well. So real quick, I'll just throw up a couple slides and then we can go back to them. Um, we had a fair number of respondents from Washington, and it was predominantly Samoan. And we found that about 78%, which is actually pretty good, were okay with getting the vaccine, and only 22% hesitant. So this falls very well into the national strategy to get about at least 70% of the population vaccinated. And as we talked on previous episodes, this is not the case with a lot of other states. So kudos to Washington. And then, Joseph, I'm sure can tell us a little bit more about um, uh, what the reality is there. And then, as you can see, the breakdown by zip codes, it varies. We didn't get well, there wasn't a large area where we were getting a ton of responses from. Um, and I don't know these as well as Joseph and Malik know them. I just know the 984s are probably near Tacoma.
Mhm.
Uh, and then it's predominantly female respondents because we have a lot of female leaders
Yeah.
in our community. And the breakdown didn't seem to be very gender specific uh,
Mm.
in regards to hesitancy versus not hesitant surrounding the vaccine. This kind of falls in line. So this is educational attainment, uh, and these are listed here. And the grayish, bluish pillars, those are the hesitant. So those are the people kind of questioning whether they're going to get the vaccine, whereas the pink bars are people more open to it. And so this is something that you see kind of throughout.
Yeah.
Whereas the upper level degrees and educational attainments have very little hesitancy. But then as you go down, you start to see them be more equal. Um,
Mm.
and uh, you see that with income level a little bit. You know, people that make more money seem to be less hesitant around the vaccine. And as you go down, that's where you start to see them be a little bit more even.
Yeah.
Our essential worker breakdown, thank goodness, in Washington, that the essential worker hesitancy is lower. That's not the case in a lot of other places, in a lot of other states. And I think that's it. Give me one sec.
Thank you, Dr. Samoa. That was awesome. Look at you.
That's it in a nutshell.
That
That's
was
what I do in the middle of the night,
oh,
uh,
yeah, at midnight.
at midnight. Yeah, and so I would love to get feedback from Joseph and Malik on how things are going and what these numbers register as.
Yeah.
Are they realistic?
Yeah, I would say those are pretty accurate though. They kind of reflect though the numbers. I just checked earlier today in the state of Washington. About 74 people who are eligible to get the vaccines got their first dose in Washington. And I think fully vaccinated is like 69%, which is kind of like almost that first graph that you had though.
Yeah.
There's still some hesitancy. I know Joseph was close to where the most of the people who answered that survey are living. There's still a lot of misinformation. A lot of people are still skeptical about the vaccine, despite its safety. Uh, that we all know about, though. Um, but yeah, I would say though that those are kind of reflecting what we're seeing in the front line as well. Um, in the hospital where I work at, Skagit Valley Hospital, um, we've seen a lot of spike like everybody else. I'm pretty sure that kind of
Mm.
mimics the national curve where, July, August, with the Delta variant, it kind of spiked up, came down a little bit, but then after the Labor Day holiday, it kind of went up again. The good news is that we're seeing a dip in the numbers. We who work in the front line now almost didn't want to say that it's dipping because we're afraid it might pop up though. But we're hoping that people are finally listening, and with the mandate that our Governor Inslee has stated though, by October 18, every employee of the government, the federal government, should be vaccinated, fully vaccinated, or they're gonna, you know, lose their job. And I think that's gonna help some of those numbers go down. Um, but I'll let Joseph talk a little bit as well, see what he's seeing from his side.
Thank you, doctor.
Yeah, thanks, Dr. Malik and Dr. Ray. So they're like what? Let's see, about 70,000 Pacific Islanders and HPIs in Washington State. We're predominantly our highest community is Samoan, then it's followed by Native Hawaiian, Chamorro, right? And then we have our Micronesian communities that are following behind. But yeah, the numbers are pretty accurate. There's been just a concerted effort, across Washington State with Pacific Islander leaders to drive Pacific Islander clinics, vaccination clinics, food distribution. I think geographically, Washington is a little bit more of an intimate state. We're able to coordinate stuff a little bit stronger. I know California, it's wider spread out, right? A lot more
Mhm.
people, and for us, yeah, there's just. I mean, we're probably the third largest state, right, after Hawaii and California with Pacific Islander population. So we're actually doing really good. I'd say these are efforts, like literally concerted efforts, and it's everybody. We have our pastors that have been partnering with us from the beginning, young people, healthcare providers. Everybody's doing their job. Dr. Malik. Yeah, so we're really grateful. We do know that when you do look at area code specific data, that places where Pacific Islanders are concentrated in, they're a little bit lower than their other zip codes. So, for example, we moved here, our office in Federal Way, which is 9800 3. We specifically moved here because they're the zip code with the highest health disparities for our peoples and also the highest concentration of our peoples. That's why we came here. And it's surprisingly, or it's not surprisingly, it's also the zip code with the lowest vaccination rate, compared to other zip codes in King County. And so um, I'd say there is some work to do with our more evangelical based churches, our Assembly of Gods. The Pacific Northwest is an Assembly of God base here through Northwest College that has driven a lot of our folks, our assembly folks here. So there's some work to do there to catch our populations in those communities, up. But yeah, definitely coordinated effort across the state.
When you get data like this, and I guess this is more for uh, Dr. Malik and Joseph, but when you get data like this, are you are you expecting certain numbers? Like, do do surveys kind of confirm what you're already seeing, or do sometimes numbers come out and you're like, wow, that's like an eye opener? I know both of you said that the numbers appear kind of what you were expecting, but do you ever get the any of the data as we get it back? And great job to Naopo for getting the needs assessment done. But do how much do you trust the data? And does it matter if it's a PI organization that's gathering the data for your level of trust?
Yeah, I would say it doesn't really surprise me much, though. I think the breakdown in terms of education level, in terms of the income, because what I've seen though, so I live an hour north of Seattle, though, so there's a few polys up here, uh, but it kind of I would probably see the Hispanic population are like the most we've seen though, which kind of mimics what's going on in King County with our Pacific Islanders. That those are the ones who are really end up in the hospital. And when you ask them questions like, "Hey, did you get the vaccine?" And sure enough, though, their answer is no, uh, because we know though through data that these are the populations who don't have much in terms of the information. They don't have good experiences when they go in the hospital compared to our white Caucasian counterparts because of the treatment that they received before it, or there's a mistrust in the health system. So when we advise them to get the vaccine, there's a lot of mistrust though, and I feel like that's the same thing that's going on with our Pacific Islander communities. That they're afraid of the healthcare system. That there's some trust issue. That they don't follow everything that we're telling them because there's maybe experiences of the healthcare system that kind of failed them. We kind of knew about these disparities even before the COVID, but the COVID kind of, exposed a lot of these things that people are going through. In terms of the salary as well, we've seen a lot of the essential workers who don't make that much are hesitant to get a vaccine, maybe for reasons such as immigration issue, that they're afraid they might be, identified by immigration officers and things like that, or they don't want to get the vaccine because they do want to go to work, but they're afraid that they might get tested and tested positive, so they have to stay home. In my own personal experience was there a lot of Mexicans who show up in the hospital as soon as they get there, or they want to get out though because they want to go back to work because it's the only way that their family get the income that they need to survive though. So there's a lot of issues like that that I personally see that I could see also translate through the races to our community as well, that they have the same issues though when they go there. Um, I think, yeah, we've seen a lot of, I'd probably say 95% of the patients who are admitted in our hospital are not vaccinated. There's only a few who show up, but basically they just show up for other reasons, but they tested positive, which kind of mimics exactly what the Moderna and Pfizer vaccines were made, that they kind of decrease hospitalization in people who got the vaccine. So the data is really not surprising to me, though. I mean, I could probably say though that I almost kind of predicted that those were the numbers we're going to see, though.
Thank you, Doctor. How about you, Joseph? do usually when PI data comes out, are you more confirming? Does it more confirm what you already thought? Or are there things that really stand out to you? And then the second part, does it do the results, the trusting of the results, matter in terms of who gathers the data?
Right. I think it's like I trust it more so than other people doing it, right? For sure. But I know that there's complexities in gathering data with our population, right? That it's, it's not so randomized, right? Because our communities are clustered, so it's like we're going to places where our members are going to be, and I just wonder like if if there's opportunities to survey folks that are not involved, right? That are not coming to Pika, that are not coming to, our programs, right? And how do we reach those folks, those islanders? But I definitely trust it a lot more than other sources of data because we know our communities, better.
I feel like you're
Now,
throwing shade at some of these public health departments who are reporting over 100% vaccination rates in our community.
But
Um,
they're not really talking about us, right?
I don't
They're never
know.
talking about us. I feel like
Yes.
because our numbers are not disaggregated, and we have to go in and do it ourselves to get the true numbers, which is what you all have done, to show the true numbers. The patients, Dr. Malik, that come into the hospital, um, testing positive with COVID that haven't been vaccinated, do a majority of them leave? Or, because what we're hearing in the news, and the, a lot of groups are saying that if you're not vaccinated and you get into the hospital and you have severe cases of COVID-19, the chances of you leaving the hospital if you're on a ventilator is low. Is that fair to say because you're not vaccinated, or does it depend on the person and if they, their health disparities?
No, it's a sobering thing though because just last week though the state of Washington recorded 7,000 people dying from COVID,
That's
and I think nationally we're over 700,000. So there are people dying in the hospital actually.
Mhm.
Unfortunately, most of them are the younger patients, 30, 40, 50-year old. Um, as you guys know, though, most of our elderly who were dying last year got protected because they were the first one to get the vaccines, though.
Yeah.
So they're not really the one dying, though. We're seeing a lot of younger uh, patients coming into the hospital and eventually not leaving, which I mean, I'm pretty sure other states are seeing as though our hospital are running out of beds, though.
Yeah.
Last year there were people who were afraid to come to the hospital, and there was a lot of focus on COVID, so people weren't following up with their primary care doctor, doing screening and following up with their diabetes, their heart conditions. So what we end up we're singing though early this year though, a lot of those people come into the hospital and they're very sick. Typically they're staying for 1 to 2 days, but these are the really sick people though. But then it kind of coincided with the Delta wave coming in, and now in the state of Idaho and Alaska, though they're overwhelmed, their healthcare systems are overwhelmed though. So in the state of Washington, we're very close to that as well. Um, people are waiting in emergency room for 2, 3, 4 hours waiting for a bed though, and we're seeing a lot of that though. So you know, adding that to for us doctors seeing younger people die, it really took a toll on our mental health though, because last year the elderly people were dying. And now with younger people like 30, 40, 50 who have young kids, they'll end up being, you know, without any mom or dad, though, which has really affected the mental health of the healthcare workers, including nurses who are now quitting. There are doctors who gave up medicine altogether, though. So it's really a tough situation, though, seeing these younger people dying when there was, in fact, the vaccine that would have protected them. In fact, a lot of them personally, I asked them, though, why didn't you get the vaccine? And the number one answer is that I wish I could have gone back and get it.
Yeah.
But unfortunately for most of these people, oh, they never made it out of the hospital. But I hope that their death and their stories will convince other people to go and get vaccinated, because really though, people don't see what's going on in a hospital, but it really affected people who are there, because the amount of people dying when there's in fact a vaccine that could have saved them. So it's pretty tough.
Very tough. It's so sad to see that now that the elderly have taken the vaccine, they're the one,
Uh,
their numbers are lower.
I
And
just want to say, Naki, of all the COVID patients I see, though, I've yet to see one who came in because of the side effect of the vaccine that people are afraid of. Not one.
nice,
So
nice.
since the vaccine came out in December, I have personally, and I swear on my family, my kids, that I'm telling you the truth, though, I have not yet admitted anybody as a result of the vaccine side effects. So I just want to share that information because it's important for people to know that it's pretty rare to have those side effects. But don't lose the chance to kind of save yourself and save your family by getting the vaccine. So
Definitely, definitely. And I think that's a lot of the false information or
mhm,
the severe, oh, I don't want to because I'm going to get side effects that are going to, I'm going to
mhm,
grow an extra finger or something like that. Something crazy where we know that people are just not listening to the science, to the doctors, and so, and what I love about what you guys are doing is you're educating and getting our community resources, um, getting them to the churches, getting them to the community-based organizations, because we always say this, it's people that look like us, and that's who we trust. That's who we trust. We if we say that, you're saying this, people are seeing you say that, then of course they're going to trust you because you're a Pacific Islander who, of course, who we trust. Dr. Samoa, who did a great job with this survey, is that's who people are going to go to, not CNN. We don't get our news from CNN. That anything that pertains to Pacific Islanders, we get them from like the community leaders like yourself.
Yeah, I mean, the network is strong. Like, one of the things that's nice about not being surprised by results is that it validates those efforts. Yeah.
Yeah.
So Joseph was pivotal in getting data survey respondents from Washington. And the reason why that's important is because uh, that utilizes decades of community wisdom in regards to engagement, because we don't have data, you
Right.
know, like it, and when you get data, if it correlates with what is seen by community experts, then you have validation. The problem we have right now is a lot of these public health departments, a lot of these federal agencies, they don't give a lot of credit to community-based data collection methods. A lot of the complaints are that you're nested, which means that you have a community that kind of knows each other. So a lot of your respondents are going to be biased. But my thing about it is then validate it.
Yeah.
And I think when we look at the vaccination hesitancy and the vaccination rates in the states, they correlate so well that I'm like, we're validating,
Yeah.
that's validation,
Right.
whereas you have nothing, right? Like, so far you've given us jack nothing to work with except that we have high rates. And so it's high time that these public health departments and agencies start, doing something, because of right now the lip service is given to health equity, and to social justice. But when they fail to sort of look at what's working in our communities, I don't see anything. I don't see. It's just talk to me. If you're doing nothing to do what we know works, um, yeah. And so maybe Joseph can tell you a little bit more about like how he uh, persuaded. But that comes, like I said, the engagement. doesn't come up because Joseph showed up one day and was
Right.
like, fill out our survey. You know, there was like community, there was food distribution. I'll let Joseph talk about
Oka.
it.
Yeah, sorry, y'all. I had a little irritant in my eyes, so let's rub it out for a second there. But yeah, I mean, a lot of this is like capacity, right? How do we grow the capacity of our communities to do what they do best, which is outreach to their own communities that are natural, right? Because everybody knows the culture, everybody knows the language, and also I think there's a very explicit commitment that PICOA has to make sure our Melanesian, Micronesian, and our different Polynesian communities are at the table, and that we're increasing capacity for all of our different communities, so that it's really easy for folks to access things like surveys, right? And also, when you're doing surveys, that's somebody's time, right? You know, it's like when you meet with somebody who has money, like their time is paid for, but you meet with somebody who has, you know, a lot of kids, you know, he has to get childcare to come and meet with you. And we don't acknowledge that we need to pay their time, right? Or at least honor it, right? If we can't match it with a decent amount of a gift card, you know, at least figure out ways to match it, consider the transportation. We're lucky to have like money to set aside for Lyft rides, you know, to make sure that families are, you know, are not having to take the burden of all of that, right? And so I think those are things that we know in our community that, you know, some other person might not know. For example, classic example, we met with the governor a few months ago, and he just had no clue as to the condition, the material condition of Pacific Islanders. He thought we were having thriving centers with buildings all throughout Washington. Why don't you guys just open up your building and we can bring all the money there and do everything? And then I'm like, what money for what rents? Like we
Right.
just opened up a building in King County. You got the guy that runs our state has no idea of the material, you know, well-being of its members, especially Pacific Islanders. And he was really offended when I told him he doesn't care about Pacific Islanders because that's how it feels on the ground. If we're having to beg for resources
Right.
and justify our community outreach strategies to all these people that don't know anything about community outreach to beg for resources and money, right? That's supposed to come to us first. Um, yeah, so those there that's where a lot of the issues that we encounter. Yeah, we made him cry. The governor, he like you know was like, oh no, I love Pacific Islanders. I'm like, you love to see us dance? Do you love us on when we do our luau's? But do you actually love our people to be committed to the material transformation that needs to happen for our people to have some sense of power and shaping, you know, like their lives here in Washington State? Like, you know, like, are you committed to that? Because you're not, you know, at this point. And how do we get you to start that conversation with our community? So, yeah.
I think I think Joseph said at some point sometimes you should just tell them how you really feel. Don't hold back.
Yeah, don't hold back. Don't hold
But
back.
they need to hear it. You know what I mean? They need and sometimes that we'll see, you know, advocates or community people get caught up in the moment and they're in front of the governor, so they don't say, you know, things where 15 minutes later they're like, I should have said this. So good for you, Joseph. Good for speaking up and seizing the moment. We worked with some wayfinders of yours, and we're asking questions about the vaccine, and the wayfinder said, I don't know how to put this. Joseph's good at persuading people to do things. So keep using your influence, and you know some of those people in those positions need to hear those words. We had a question in the chat for Dr. Samoa, and it is from Eddie Unatoa. I think he's in Hawaii. It says, Dr. Samoa, would the Merck pill help with getting our NHPI vaccinated? And I'm not sure what the Merck pill
Yeah, what is a Merck pill?
is.
There's there's a phase 3 clinical trial with what's it called? It's an antiviral, molnupiravir. It's so the phase 3 data looks good, but so did remdesivir. And you know, Malik, remdesivir has done nothing for us. It was like it had really promising phase 3 clinical trial outcomes. Phase 3 is kind of the step right before you get FDA approval. That's kind of where you use it in practice. That's the research part of where it's used in patients.
Mm.
And I have not seen remdesivir really turn the corner on a lot of people who are dying of COVID.
Mm.
Um, it's but we still now it's standard. Now if like somebody's really sick and on the vent, we use it.
Yeah.
Um, and this new drug, I think, is if that's the one. I don't know if it would do anything in regards to vaccines, but it's an antiviral that's supposed to help like decrease viral replication. Um, so you
It's
know,
actually not a pill. It says doctors are excited about the medicine
molnupiravir.
molnupiravir, because of a regimen pill. It would be given intravenously, and it is. It's treatment for patients that have
Right. It's
COVID-19. So
it's it's phase yeah. It's in phase 3. I don't know if that's it.
So I would just say though, what growing up in the islands though, they always say this to me though: prevention is better than cure.
Yeah.
With
Yes.
the vaccine though, you would not have to worry about treatment.
Right.
You because most of this treatment or when you're in the hospital, the vaccine is doing what it's doing, preventing people from getting to the hospital. So I know a lot of people. There's a lot of news around this new medication though, but I just want to have people put in perspective though that the vaccine prevents you from getting sick, and then you have to be treated, right?
right. Well, it's
So
good to have treatment, right, as an
yeah,
option. And if you
as
don't
an
get it,
option,
yeah,
as an
why not
option.
try to not get it versus
There's
waiting to.
monoclonal antibodies that we are using in the hospital, but we're our number access to those are going down as well because there's so many people with the Delta variant. We're running out of medications though, so if you bring in another medication though into treatment though, again, who knows, like kind of like what Dr. Samoa is saying. Initially, it might mimic what the study is showing, but then we're going to deal with more variant. There's more variant coming down the line. Who knows though if that's effective against those variants when it comes out. So I would say you know it's good to have a treatment option, but prevention I think is where our focus should be. By people going out and getting the vaccine, just one shot, two shot, you're done. You don't need to worry about treatment and being in the hospital because you're safe
Yeah,
from that. So I would say that
makes
that would be my 2 cents on that one.
makes sense. Avoid a trip to the hospital. Avoid
Right.
all
Hmm.
that.
I
Try to
mean, that's
not get
the
it.
big knock on vaccines, right? Is I don't know. There's so many posts that I see that talk about, oh, but people with the vaccine are still getting COVID. But it's like Malik said, they're not getting admitted to the hospital
Hmm.
in those percentages, and they're not dying
Right.
as
You
much
know,
as people who aren't getting vaccinated. But just like Malik said too, the reason why we don't have like a polio variant is because we all got it. We all got the
Right.
vaccine, and it helps, you know, halt it in its tracks.
hmm
And unfortunately, it's become really political, and ignorance kills our people over and over and over again. Like Malik, when was the measles outbreak in Samoa?
two
That was
years
in
ago, 2019. It was just before the COVID.
before, like
Yeah.
6 months before COVID,
Hmm.
right? And before
Yeah, yeah,
Wuhan got COVID.
yep.
Yep.
So, 53 kids died, because of ignorance, and granted there was a sentinel event that got people afraid, but
Hmm.
people manipulated that situation to drive the ignorance up, and kids
Hmm.
died, and I think the thing that really bugs me is those people who had a hand in those kids dying have nothing to say. In fact, they double down, you
Hmm.
know, and I that's the part that kills me as a physician. You have people flexing, that they're not going to get vaccines, but they're going to come to the hospital and we're going to take care of them,
Right.
right? Like we have no choice in the matter.
Right.
And so, that's. it's starting to take its toll, because if you look at um, healthcare providers, if you look at healthcare professions, they're dropping.
Yeah.
Less people are going into these professions, and more people are leaving them. You know, and it's because I think the pandemic is a large reason for that
I think so
happening.
too.
There's other things going on too, like lack of staffing, so we can't even get people in training positions.
Mm.
But expect to see in the next year a huge shortage of nurses. There's also a gap. It's slower than the nurses, but there's going to be a gap in physicians as well. And why does it matter to us? Guess which community is going to suffer the most, right? The community that already has the worst outcomes. That's us, you know. And so when we talk about it and we get on our soapbox and we try to preach about it, it's not because this is the only thing we care about.
Right.
The entirety of the health of our community, um, you know, relies on us getting through this and getting, finishing this pandemic. I don't know why that's political.
Yeah, it's crazy. When we had our triplets, there were people talking to us about vaccines and those kind of things, and our position was, look, there are ingenious men and women that worked their entire lives and put things into stamping out things like smallpox and polio, and
Mm.
the reason it worked is when they put all that time and dedication and effort into it, people took the vaccine. That's why they're not the way they were when they're wiping out 3% of the Earth's population. So it's crazy, and you're right. It's where does that mindset come from? How does it get polarized or politicized or whatever, to the point where we're just saying there's a cure, not a cure, there's a level of protection that's available to me. you know Millions of people wish they could get the vaccine
Right.
that don't have access to it. Um, okay, so we've definitely talked about that. Did we have was there more information to share from the needs assessment?
No, no.
Okay,
Yeah.
I was going to talk about. I was on a call last week um, and this week, separate calls, and both of them dealt with data. It was They're both dealing with data. And one, the reason I asked about the trust thing, Mackie and I had talked about this on the show on Sunday. I was on a webinar where they were talking about Latinx, African American, African American, and Samoans that aren't getting the vaccine. And the panel, and I was trying to get over it, didn't have a Samoan to present the data. So there was an Asian person presenting the data, and I had to really get in my head and say, just listen to the data, listen to the numbers, don't worry about who's delivering it. But that was why I'd ask about the trust thing. Like, you just want to hear somebody say it that that looks and sounds like you. And then the other one had data from 2014. So both of those were showing how important the data was.
Yeah.
Um, do you think this is something that a trend that's going to continue as we exit COVID? That we continue to gather our own data and I guess steer our ship with our information, or do you think this is COVID specific? That this we may regress a little bit when we get out of COVID, whenever that may be. I'll throw that out
Is that a challenge,
to
Carl?
Joseph.
It's a challenge.
I feel like it's a challenge. No, I mean, I don't think it's gonna be. I don't think it's gonna be one of those things where, we got popped out of. I don't know, that Jack in the Box thing, right? Where you pop out. Like, I don't think it can put us back in.
Exactly.
Situation, and I think it's a movement. I mean, how we sustain this movement to continue to push for NHPI data, autonomy, and also political voice, right? Forming our infrastructures that we need to form to inform, the work on a national and also a local and state level. So it's not going to change, Carl. How dare you ask that question? um, I think we need to continue to do the work of bringing our communities in, because we don't want to do this work without making sure that our communities are being brought along, right?
Mm.
I mean, even if the NHPI thing, like like whose grandma knows what that means? Like
Yeah,
nobody's grandma knows what that means.
right.
And so the High Makamaka crew, that's Dr. Malik and Dr. Ray and us over here, but we need to figure out ways to continue to loop back to our communities and bring them along, right? Yeah, not just like voting. Voting is a new thing for a lot of our communities, right? A
Right.
lot of our community members are new voting Americans, and so it's all of the we have to do the whole package, right? And not just health justice.
Yeah,
Thank
I
you,
would say,
Joseph.
since last year, the word that is in a lot of companies, including hospitals and big healthcare system, is diversity, right?
Right.
I think the COVID-19 kind of put that and make it a priority to a lot of these big companies to develop diversity. In fact, last week, though, I had to watch several videos about diversity,
Mm.
from the company where I work at. But the problem is, though, you preach diversity and then you look at your workforce and it doesn't reflect the community you're in, though. There's
Exactly.
only one Samoan, you know, Joseph, am I one of few Samoans in the state of Washington? So
You're the only
really,
doctor I know, yeah.
yeah, so diversity means your workforce should reflect your community. So we need more Samoan doctors. We need more Tongan, Fijian, whatever the population is. So the state has to make slots in medical schools and people with researchers to allow our people to come in, because really though, you guys are not the only one I work with though. There's Samoan radio in Utah who I uh, was invited to talk about the vaccine though
Hmm.
in Samoan language. And in fact, a lot of people say, I've never heard a Samoan doctor say anything about the vaccine. This is the first time I've ever heard it. And I feel like I reached a lot of people through that effort. And then, like, we need more of our people to be in positions like me and Dr. Ray are in.
Yeah.
We're linking up to Association of Medical Students in the whole of the U.S. though, and try to show them how to get to the level we're at though. But people need to kind of help us get the diversity that they're preaching about
Right.
happen in the span of a few years, so that our people will look for news and information and see doctors like me and Dr. Samoa
Yeah.
talk into them and gain that trust though, and you know remove the doubt and the hesitation that they might have though, when in fact though, when they finally trust somebody that looks like them. So I think we've come a long way though. But I'm just skeptical. I'm hoping that good things will come out of this pandemic though, that
Yeah.
there's a lot of lessons to be learned, and hopefully it will turn that we're the one who benefits from that. So
I share Malik's skepticism in regards to change in data. Um, I'm not as hopeful. I think we'll go back to the old way as soon as the pandemic is over. So there is a window. There's a window we have to get as far as we can so that we can change things. You know, um, like, does anybody know the NHPI diabetes prevalence? No, it's wildly inaccurate, right? Because we don't have a good way to refer to it. We don't know our cancer rates really well. You know, the only way we know it is if you go through the Sears registry, which is kind of a registry of cancer outcomes nationally, and you pull out Pacific Islanders. And the problem with that is it takes time. It's work, and so to do that, you need to pay someone to do that. Right now, you know, it's okay for federal agencies and health departments to say you're too small for us to do anything, right? Like, we're not part of the NHANES. King County and Utah are one of the few places where they actually have disaggregated Pacific Islander data. It is what it is. But you know, from trying to figure out where we are, um, is horrible. It's really hard for doctors to get a good grip and to see where our problems are. COVID has kind of shown us that we can do it, and we can do it ourselves, and we can lead it. And the push that we have now, and this is where we have to do this with other communities of color, is to continually push towards this, um, uh, racial justice, health equity standpoint, because we only have a little bit of time before people stop listening to us, right? And we have to, uh, we got to put ourselves in places where it's relevant for us to be able to talk about that. And I think right now it's we have some opportunities to do that. That's Naupo was a huge step. Happy was a huge step. Um, but now that we kind of got sort of the structures in place that need to do something,
Mhm.
this is where the work begins, right?
Right.
This is where now we have to sort of work together to get into those spaces, and move the levers that need to move.
Right.
It's I think the longest time all we did was sit there and complain, and we would just talk and talk and talk, and nothing happened.
Right.
um, and so now that we know like who does what, um, and where we have to be to be a pain in people's sides,
Right.
um, and now that we know how to do it, we know data collection, we
Right.
know data analysis, we know how get meaningful data for policy changes, and then we
Right.
know how to change policy. And so the time is right for us to use the lightning in the bottle.
Right.
um, but I don't know how long we're going to have it.
Yeah. I think I agree with everyone, and I also agree with what Joseph said about the Jack in the Box. Like, I think now, like with all the health issues that Pacific Islanders have, like right now we're dealing with COVID, but I think because we're talking about PIs and how COVID is hit us hard because of diabetes and heart problems and gout and everything that I like, you can't get me back in that box anymore. You know what I mean? Like before the pandemic, I didn't know anything about our data and why our numbers are high. But now I feel like a lot of people are like Opic came out of this, Pikawa came out strong, Happy was created, now Opal was created. Now we have the tools to really push cancer and diabetes and everything that affects our community. So I agree with you that this is the window, but with this window, look how many amazing, happy came out of it. Who knew that this, because of the pandemic, we have all these doctors that got together that are going to work to help educate and get resources to other illnesses and ailments that the PIs and Pikawa is everywhere and doing everything and Malo and Naopo. I mean, everyone in Naopo, you can't put them back in the box now. And I feel like a lot of PIs, and you're right, this is where the work is going to start. Now we're going to push for everything else that our community hasn't got. And we didn't know. We didn't know we needed all this data. We didn't know we could get resources from the government and policies. We're changing policies to fit us. So I think that's awesome. And all of this is because of all of the work that you three are doing and all our community-based organizations that are pushing. Like, it's crazy that we don't exist until they see the numbers. And so now that's what we're pushing, is the numbers. And of course it's you three and all our community leaders all over the states, that are, Utah is big too, and Melissa in Arkansas, ACOM. So a lot of amazing things are starting to happen for PIs. And Carl and I say this every week. This is a great time to be a Pacific Islander because our faces are getting out of there. You're seeing us, you're seeing the numbers that show we're here. We're here now. And we're not going nowhere. We're not going anywhere. So I appreciate the work that you guys are doing to share the information and just educating our community and helping us get what we need and really, like, we're pushing vaccination and giving you the choice. We're asking you to do your resource. We're not telling you what to do, but this is what happens when you get vaccinated, and this is what happens when you don't. And because of our numbers and all our ailments and stuff, I appreciate the time that you guys take to help our community. Sorry, I went rambling on because I'm so proud of you three. I'm so proud of you three. It's the work that you guys are doing, and
Don't forget
here's
the
$1 million.
council.
Here you go. Here's $1 million.
Yeah.
Don't forget the media council too.
Yeah.
Hey, we're just broadcasting people. It's easy when we have people like you coming on the show. But I think you're right. It's not a limitless window of opportunity. So we're knocking on the door, we're opening the door, whatever. We got to get through it and keep moving. So appreciate the time. Now what am I doing? Naki's going to take us home.
Yeah, like Carl said, Joseph, all the work that he's doing with Pikawa, Dr. Samoa and Dr. Fuimaono, with the work that you're doing, where you're at, and then happy that, I'm so happy that this has been so many great things is coming out of the pandemic, besides all the sadness and the death and the illness, all the things that our community is doing to get us seen, and we're here and I think it's the biggest thing that gets the disaggregating our numbers was huge in every county and every state. So it all, again, because of you guys and the work that you do. We appreciate the time that you gave us today. We're going to give you back to your families. Dr. Samuel is going to work until 11 o'clock. Dr. Fuimaono, thank you so much for your time. Today's your day off, and we stole an hour from your wife. We sorry. And Joseph's going to
That's okay. He needs to give more time to community. Don't.
Get him, Joseph. Get him.
I will talk to you later, Joe.
We're grateful for your time. We really are. We're humbled by you guys showing up here and educating our community. We're here every Monday at 5 p.m. Please go follow Happy Doctors. Check out all the information. They're going to have a website.
Get vaccinated.
Get vaccinated. Check out Pikawa on all social media outlets. We thank you so much. God bless you. Have a great day.
Thanks, Pacifica by Design.